Hello my geniuses, welcome to another head and neck lecture series today. It's a great science to Lorenzo and we'll be talking about fontanelles today. We have talked about the exterior aspect of the skull. We have introduced the skull already. So we're talking about fontanelles. So fontanelle is very important. If you are new to my video, make sure to subscribe and turn on your post notification button. So anytime I drop any video, you'll be sure to be notified. So we're talking about the fontanelles. Now what do you think about is the fontanelles? So the fontanelles are soft membranous gaps between the bones of the infant skulls. So the fontanelles, they are very soft, put it first, soft membranous gaps between the bones of the infant skulls. Are you getting me now? They are formed where the cranial suture inserts and consists of a dense connective tissue. They are formed where the cranial suture is inserted. Now the fontanelles are soft membranous gaps between the bones of the infant skull. So they are soft membranous gaps between the bones of the infant skull. Are you getting me now? And they are formed between the sutures, where the sutures meet themselves. I told you the coronary suture meets the sagittal suture, and the sagittal meets the rhomboid suture, and by the sides they meet at the asterior and the anterior too. So that is also a suture too. So we'll be looking at all of them. The fontanelle play a crucial role in childbirth. I get it. It plays a very crucial role in childbirth and also the early development of the brain by allowing flexibility of the skull and accommodate rapid expansion of the developing brain. So even though as the brain is getting bigger, the skull also allows and accommodates it to the fontanelles. Are you getting now? So and their size, shape and the time of closure are very important indicator in the normal growth and the neurological health in infants. So very easy. I told you it's soft membranous gap between the infant bones. Are you getting now? And they are formed where the suture meet themselves. You get it now, where the suture meet themselves. Very easy. So now what is the developing basis here? During fetal development, the skull bone was formed from intermembranous ossification, because there are two types of ossification here. Yes, endochondral ossification and the intermembranous ossification. So the skulls are formed from membrane, intermembranous ossification, because after birth the cranial bones are not fully fused. Are you getting me now? They are not fully fused. They are connected by sutures and fontanelles, but these sutures are incomplete. Are you getting me now? They are incomplete due to incomplete ossification, allowing remodeling of the head during delivery and postnatal brain growth. Do you understand it now? During delivery and postnatal brain growth, so the sutures are not closed so as to allow expansion, because in children now there might be more increase in brain development. So when the brain is developing, you don't want the brain to be tight inside the skull. It can come with some neurological deficits. So that's why they are not fully fused. They have what we call a fontanelles. You get it now? So very important. Now the next we'll be talking about is the types of fontanelles. How many types of fontanelles do we have? We have introduced the fontanelles. We have talked about how it is developed. Now we are talking about the types of fontanelles. We have 6 types of fontanelles. 2 are unpaired and 4 are paired. So 2 are unpaired, 4 are paired. So you'll be seeing it on your screen one after the other. Now you have the first one, which is the anterior fontanelles. The anterior fontanelles is unpaired. The anterior fontanelle, what shape is the anterior fontanelle? It's a diamond shape. It's a diamond shape in a junction between the frontal bone and the two parietal bone. That is the brachma part. That's where you see the anterior fontanelles. It's about approximately 3 to 4 centimeters at birth. You get it now? 3 to 4 centimeters at birth, and it closes almost 2 years when the child is 2 years. So everybody closes before birth. It is only the anterior fontanelles that reaches 2 years after birth, 12 to 18 months, sometimes 2 years. Get it now? So it's clinically important, very clinically important, because it's used in pediatric assessment to check the hydration of the child and also to drain so many stuff. Get it now? Which we'll be talking about. So we also have the posterior fontanelles. The posterior fontanelles is triangular, while the anterior fontanelles is diamond. The posterior fontanelles is triangular, and the junction between the parietal bone and the occipital bone at the junction called the lambda. You get it now? So we have the anterior fontanelles, which is diamond. You have the posterior fontanelles, which is triangular. So now another thing is similar to the anterior fontanelles in size, about 3 to 4 centimeters at birth, and also it closes about 2 to 3 months. 2 to 3 months, about 4 to 6 weeks, 4 to 8 weeks, which will reach about 2 to 3 months. Are you getting now? So the next one is the what? The ones are the two paired ones, which is what? The anterolateral fontanelles, or we call it the sphenoidal fontanelles, at the terion side. So it's combining of four bones, which is the frontal, which is the parietal, the temporal, and the what? The sphenoid bone, which you call the terion. Remember the terion. It closes around 6 months. You get it now? 6 months. Don't forget. We have the posterolateral fontanelles, or we call it the mastoid fontanelles. The mastoid fontanelles is located by the combination of three bones, which is the asterion. Remember the asterion. The anterior fontanelles is the brygma, posterior fontanelles is the lambda, anterolateral, which is the sphenoidal, is called the terion, combination of four bones, while the mastoid fontanelles, or you call it the posterolateral fontanelles, is what we call the asterion, combination of three bones, which is the parietal, occipital, and temporal, and it closing by 12 to 18 months. Now, what's the function? Why is there the function of the fontanelles? Why is it there? I've said some before. To allow the brain to grow, because when the brain grows, there will be increase in what? Intracranial pressure. So it accommodates rapid increase in brain size during infancy. The next one is what? It facilitates childbirth. So during childbirth, it allows overlapping and remodeling of the skull during the passage through the birth canal. So as the baby is coming out through the womb, it allows remodeling. You get it now? So the clinical window here is through the fontanelles. It provides indirect information like the hydration status. I told you whether the patient is hydrated or not. Intracranial pressure. When the intracranial pressure is high, the fontanelles get to swell up, and also the skeletal development. If it doesn't fuse fast, it shows that there's issue with the baby. So another thing, what is the clinical significance here? In normal finding, like I said, it is soft, flat, and in a calm upright in infants. Are you getting me now? There will be slight pulsation during what? Increase in what? Cerebral blood flow. Are you getting me? Where there's not a problem is when there's a bulgy fontanelles. When there's a bulgy fontanelle, as I told you, there's an increase in intracranial pressure when there's a bulgy fontanelles, especially in the case during hydrocephalus. When there's increase in CSF fluid in hydrocephalus, and when there's meningitis, inflammation of the meninges. Suckling fontanelle shows that there's a dehydration. The patient is dehydrated. The baby is dehydrated. Delayed closure is seen in Down syndrome, rickets, and hypothyroidism. We have premature closure, what we call the craniostenosis. Are you getting that? Or craniostenosis. So the premature closure is when the brain, the skull, or the fontanelle closes faster before time. If it closes that fast, which means the brain will not have time to expand. Okay, now. So the largest one of the three fontanelles is the frontal fontanelles, which closes about 2 years when the baby brain is already at least is in the normal size or normal way. Now, when the fontanelle is too large, are you getting me now? It's where it's premature and it's showing us a skeletal disorder. Yeah, now so very very easy. So it's important to know all these things. I hope it all made sense to you and you have understood everything I've talked about in the fontanelles. All I've described about the fontanelles and how you could know the fontanelles. So hope it made sense to you. So if you need me to make another topic, just put it down in the comment section. I promise when I look at it, I will make the topic for you. And also like my video and share it to your friends, people that are also studying medical related courses, so that they will also follow me and also support me as I am growing my YouTube channel where I teach clinical cases and also related medical topics. So I'll be seeing you in my next video. Bye bye.